God, why I born in India with this disease, where no one is here to support me. But just after completing my treatment, within 3 months, I got a scholarship to attend a cancer awareness in USA. It was like God to say me, you want to go US, go. And my pleasure, my honor was that I was able to meet Christian. Christian is Anna John's best surgeon. And it was, life's best pleasure and honor for me. And who knows what I can meet to Anna Johnny herself. And that's it. And now I work with the Pink Initiative. हम लोगों ने ये एक एनजीओ स्टार्ट किया है. अभी प्रोसेसिंग में रजिस्ट्रेशन नहीं हुआ है. एक यंग ऑन्कोलॉजिस्ट है डॉक्टर सुमित रुश्दी फर्स्ट कॉन्टेक्टेड हिम ओनली. सो इनकी साथ मिलके सर ने इनिशिएट किया है द पिंक इनिशिएटिव. डॉक्टर सुमित ही इज अ सर्जिकल ऑन्कोलॉजिस्ट, यंग सर्जिकल ऑन्कोलॉजिस्ट बिफोर ही वाज इन टीएमएच. सो इंडिया में हमें लगता है कि आप ऐसे अवेयरनेस को एक ऑनलाइन मीडियम से भी बहुत कुछ आप सपोर्ट कर सकते हो अवेयरनेस को. लाइक पीपल डोंट वांट टू शो देयर कंप्लीट आइडेंटिटी, पीपल वांट टू नो अबाउट द ब्रेस्ट कैंसर, लेकिन इन पर्सन आपसे क्वेश्चंस नहीं पूछेंगे. सो आई थिंक इन इंडिया के कॉन्टेक्स्ट में ऑनलाइन सपोर्ट ग्रुप भी बहुत अच्छा मीडियम बन सकते हैं कैंसर अवेयरनेस के लिए. So, I will end my slide with this speech of saying, stay hungry, stay foolish. Know the cancer, be aware, be safe. Thank you.
See, I am a technical person, but I'll speak in language which you understand about breast cancer. One guarantee I want to give that you will know about breast cancer more than me after 30 minutes. I can assure you. See, I'll be speaking in Hindi and English so that it is comfortable for everybody to understand. Breast cancer is a disease which occurs in breast. So breast is an exocrine gland. हमारी body में बहुत glands होती है. कुछ endocrine glands होती है जैसे pituitary glands होती है. And then we have thyroid gland. These are endocrine glands. Breast is an exocrine gland. The God has given breast to male and female both. In female, basically it is a secondary sexual organ. The primary duty of breast is production of milk at the time of lactation. Now, there are hormones in our body. One hormone is called estrogen. One hormone is called progesterone. So every lady is blessed with this estrogen and progesterone hormones. And because of this estrogen hormone, you are lady. And I have testosterone, so I am a boy. You are a girl, like this. So now estrogen and progesterone hormones levels are maintained just like a rhythm. So when you have menstrual cycle, in the first 5 days estrogen will go like this, in the second 5 days will come more up, then will go up, then will be down like this. Similarly progesterone, when estrogen goes up, progesterone goes down. So you have a rhythm every month, every female, after attaining menarche, after say 15-14 years of age, they have got a established level of estrogen. It will increase, it will decrease, it will increase, decrease, and you have menstruation, next cycle begins. This is a normal, usual phenomenon. If there is increase in concentration of estrogen in your body, or if there is increase in activity of estrogen, concentration may be okay, but if it is more active, then this estrogen may lead to certain cancers. One of these estrogen related cancer is breast cancer. Breast cancer is basically due to either increase in estrogen in amount or increase in its activity. So this estrogen increase will lead to breast cancer. This is a very simple hypothesis I am telling you. A simple thing. Now, how estrogen increases, why estrogen increases, there are certain reasons. If you say about 100 patients of breast cancer, out of 100 patients, approximately 8 patients will have breast cancer because of problems in the genes which they carry from their forefathers, from their parents. Now this gene is BRCA1 and BRCA2. It's also known as BRCA1 and BRCA2 genes. These BRCA1 and BRCA2 genes, if these genes are abnormal, if these genes are mutant, then these genes will lead to excess production of estrogen. And this excess production of estrogen will attack the cells where there are estrogen receptors in our body. So cells are uterus, ovary and breast. So estrogen related cancers are mainly breast cancer, ovarian cancer and endometrial cancers. Endometrium is called uterus, it's part of uterus. So these three are the cancers, common cancers in female, and they are related to estrogen abnormality. Cervical cancer is not because of estrogen, it's other reasons are there. Now I am coming to the causes of breast cancer. If there is abnormality in estrogen, the estrogen will attack the cells in the breast and they will ask the cells to multiply quickly. So breast cancer cells usually normally multiply in our body, but they multiply, but a time comes when there is a break. And when there is a break, the cells, whatever the number of cells are there in the breast, they will accumulate and they will again die. This is called apoptosis. Now when say 1 crore or 2 crore cells are there in breast, they will again die. And their place will be taken by new cells. So this is a normal phenomena in our breast or in our body. What happens? Because of estrogen, the cells multiply, then there is a break. When the break is there, the multiplication stops and the old cell dies and the new cells again come. So there is always a balance between old cell and new cells. And always new cells comes in and old cell dies. You please understand that if there is something which stops this break, that is called breast cancer. When these breaks are not applied, the cells will go on multiply. This multiplication will not stop and the breaks will be gone and new cells will keep on coming and old cells will not die. What will happen? There will be excessive accumulation of cells, and this excessive accumulation of cells will lead to something called gant or lump. Gradually this lump will become more violent, this lump will become more bigger in size, it will become more violent, it will convert into cancer. So what basically cancer? Cancer is a disease in which there is abnormal multiplication of cells without death of cells, and there is abnormal accumulation of cells, and whenever there is abnormal accumulation of anything, anywhere, there will be problem. Suppose a country like India, we have got 125 crores people. If we start multiplying and nobody dies, then what will happen? The infrastructure is limited, the food grains are limited, the money is limited, and you have got 5,000 crores, 10,000 crores people, so everybody will fight. So that is what the cancer is nothing. Cancer is a fight of too many cells, and the organ dies, that person dies. This is cancer. So causes of breast cancer, I am coming to the basic thing. Causes of breast cancer is basically in 10% of cases, 8 to 10% cases, it is genetic. There is abnormal mutation of these genes, and this abnormal mutation will lead to abnormal proliferation of cells because of abnormal quantity or quality of estrogen. This is one cause, and 90%. Now the commonest symptom of breast cancer is a lump in the breast. कोई breast में गांठ हो जाती है, that is the commonest symptom. If you see 100 patients of breast cancer, out of 100, 85 to 90 patients of breast cancer will complain of a lump in the breast. But 20% of the breast cancer may not present with lump. They have other symptoms. What are the other symptoms? There may be discharge from nipple. Discharge can be bloody. Discharge can be white type, watery discharge. Discharge can be greenish. There can be any type of discharge. This is another symptom. Some patient doesn't have discharge, they don't have lump. What they have got crack in the nipple or some thickening in the skin, some lump in the armpit. So lump in the armpit or thickening of the skin or crack in the nipple or some discharge or lump, these are the symptoms of breast cancer. So if anybody, any lady, any female, irrespective of age, has lump in the breast, has discharge from the nipple, has any wound in the nipple, any crack in the nipple, any thickening in the skin, any lump in the armpit or axilla, may have breast cancer. Regarding lump, I am telling you, all the lumps in the breast are not cancerous. All the lumps in the breast are not cancerous. But whenever you have lump in the breast, always consult a surgeon. Always consult a surgeon. Please examine, just ask him, I have got a lump, please examine and confirm whether this lump is cancerous, or this lump is non-cancerous, or this lump is pre-cancerous. There are three types of lump. Either it can be cancerous, or it can be non-cancerous, or it can be pre-cancerous. So please confirm. And another important point what I want to tell, the lump in the breast which is cancer is never painful. Most of the patient in our practice, they comes to us in late stages, they said, she is having lump for last 3 years, but this lump was not painful, so she did not consult any doctor. Now it is painful, so I am consulting. The lumps of breast cancer are never painful. A painless lump is more dangerous than a painful lump. So please don't ignore any lump in the breast which is painless, it is more dangerous. So my idea to tell you about this is very important, that please Dr. Shruti will tell you how to do self-breast examination. You do self-breast examination once in a week or once in a month at least to confirm whether you have got a lump or not. And if lump is not painful, it is more dangerous. So this is about clinical features, how the breast cancer presents. Now, how suppose a breast cancer patient or any lady comes to the doctor with complaining of a lump in the breast, how the doctor confirms that whether this is cancer or not? Being a student, you should also know all these things. These are not medical lectures, these are awareness lecture. You should know what is mammogram, you should know what is FNAC. See, mammogram is a simple type of X-ray. It is a specialized X-ray for the breast. You just go for mammogram, stand like this, the plate will come like this, it will take 5 minutes, get a picture, just like any X-ray. And the film will be made, and you see the film. See, mammogram will detect breast cancer 3 years before you have lump. So if any lady who doesn't have lump and goes for a routine mammogram may detect breast cancer even without having lump. So mammogram is actually a screening tool. Any lady after the age of 40 years should undergo one mammogram per year, because mammogram will detect certain changes in the breast and doctor will tell you these are the changes, that means you have breast cancer already started, and this will become lump after 2 years. So even before becoming a lump, you can diagnose breast cancer and you can treat it and you can achieve 100% cure. So for early diagnosis, we can do screening like mammogram, it's the X-ray. What is FNAC? FNAC means fine needle aspiration cytology. It is a simple test. We just put a needle, take out sample from the lump and examine under the microscope whether malignant cells are seen or not. These are simple tests, takes hardly 5 minutes, and next day you get the report, or the same day you get the report, whether you have cancer or not, you can know. This is the basic investigations. Now I'll tell about certain things about staging of breast cancer. Because whenever there is patient, they will come and ask what is the stage. See, in layman language, breast cancer is divided into 4 stages. Breast cancer is divided into 4 stages. If there is a lump, and if the lump is less than 2 centimeters in size, it is stage 1. It is stage 1.